76-year-old Rita Erickson is back on her feet and well into recovery after fracturing her hip 18 months ago.
I was trying to get something from my husband, which he couldn't find in the closet. So I turned in a hurry, which I shouldn't have, caught the walker on the rug that was there, and whoops, down I went.
In older adults, hip fractures are usually the result of falling and weak bones or osteoporosis. Studies show almost 30% of hip fracture patients die within a year due to complications such as heart problems or infections.
Hip fractures are very common in the U.S. Currently, we see about 300,000 a year, although they expect there'll be a dramatic increase in the numbers over the next 10 to 20 years given the aging population.
Osteoporosis is a major risk factor for hip fractures. You can reduce the risk for osteoporosis and therefore hip fractures by consuming a diet rich in calcium and vitamin D, keeping active with weight-bearing exercise such as walking and strength training, not smoking and limiting alcohol, and having a bone density test when recommended.
It gives us an opportunity to get a baseline of what the patient's bone mineral density is, and then we can decide if they need any supplemental treatment, or we can do it again in a few years and repeat it just to make sure that their bone mineral density is not decreasing.
Maybe therapy nurses.
The journey back to health has been a long one for Rita because of other medical issues. Still, she's thankful her hip surgery was successful and that her husband of 55 years has been at her side every step of the way.
Okay, you all set?
God bless him. He's been wonderful.
I'm Linda Champa.
Now, recovery from hip fractures can vary, but in general, the better health you're in before the fracture, the better your chances are for a full recovery. To learn more about hip fractures, log on to the American Academy of Orthopedic Surgeons website at aaos.org.